Hello everyone, welcome to today's video. Now this is one of the most requested video on YouTube on DMs that sir please tell the May INI-CET strategy. So in today's video, we will talk about the preparation strategy for the INI-CET exam. Now I am Dr. Rishabh Jain.
And I'm Dr. Aman Tilla.
Now we both did our MBBS from AIMS New Delhi, and Aman has recently got All India Rank 1 in AIMS Super Speciality, that is DM Therapeutic Nuclear Medicine, in this session. So first of all, heartiest congratulations, Aman.
Thank you so much. Now, before we start this video, I just wanted to impinge about one very important topic, that is the dream of AIMS, and especially the dream of AIMS Delhi. I've been in AIMS from the past 8.5 years, and if given an opportunity, I would like to spend my lifetime over here. And that is the reason I have struggled in my MBBS to get a good rank in INI-CET, then did my MD from AIMS, and now I'll be doing my DM also from AIMS New Delhi itself. Now this same dream has been the dream of all of you, each one of you, in your class 11th and 12th, then in your MBBS, and this dream continues to be there. So
AIMS आना, AIMS आना, AIMS आना है.
yes, so we all have that right to fight for your dream. Now, recently, the NEET PG 2026 date has been announced as 30th August 2026. Now, earlier we made a video together considering that NEET PG would be around the end of June or starting
Yeah.
of July. Now, because you have got this extra time, what you can do is you can dedicate your entire focus to the INI-CET May 2026 attempt, irrespective of however your preparation has been.
Yeah,
If
and this INI-CET session, this INI-CET exam is a realistic exam, which all of you have a realistic chance of cracking and getting it selected in a central institute.
yes,
Right? So this video is very, very important for you, and please listen to this video till the end.
yes,
Now let's first look at the timelines. So as Aman rightly mentioned, that the NEET PG exam is on 30th August. So on 30th August, we have the NEET PG, right? And so in the bang middle of it, we have INI-CET on 16th May. Right? So what is our timeline, that if you are someone who was targeting NEET PG and you were thinking that I'm preparing mainly for NEET PG, now you have a realistic chance that you finish your first reading till 30th April, that is before INI-CET, and then revise, do a quick 15-day revision for your INI-CET, right? This is a realistic chance that you have.
and even I'm saying that if you're not targeting INI-CET, let's suppose, even that give it as a computer-based test as a GT,
INI
realistic GT.
Yeah, so a lot of students
Mm.
say, sir, it's not INI-CT, it's INI-GT. Yeah,
Yes.
so give it as a GT. Okay. Now, how is NEET PG different from INI-CT, or how is INI-CT different? So INI-CT, as all of you know, is heavily first and second prof based. So your 60% of questions will be from first and second prof, and 40% from your third and fourth prof. So your big subjects like medicine, surgery, obs, gynae, they will be 40% of the paper.
Other very important difference is that INI-CET is much more PYQ and PYT based. So if you have mastered your previous year topics, you can easily score in upwards of making 140 to 150 corrects.
Yeah, and these are like PYTs. Now, AIMS, what AIMS does specially, is that it'll ask the same question. You also know it's a PYT, but the question formation is very different. So, AIMS asks a lot of match the following, and AIMS asks a lot of multiple statements correct. So, like they'll give you all of the following are true for cystic fibrosis, except, and there will be four statements. Now, the options will be A, B, C are incorrect. A is incorrect, A and D is incorrect. So these take time, right? So lengthy questions, okay, that is one. Now recently AIMS have started asking assertion reason questions, right? Those were pet in AIMS UG days.
Yes. So
Right.
AIMS had those favorite questions
Yeah.
during the AIMS UG time, which we gave, and my paper had 60 assertion reason questions back then.
So the type of questions will make it tough, not the content. Right? There will be few like bouncers, like half-life of letrozole. Nobody cares. Okay, you should also not care. But remember, INI-CET is heavily PYT based. You have to master your previous year topics. So let's say if ABG is asked in every exam, acid-base gas has to be mastered.
Yes.
If hematology in path is asked in every exam, hematology has to be mastered. It means it has to be read in depth. Maybe go back to your main textbook. Maybe read a little extra from ChatGPT. Maybe read a little extra from some other source. But those PYTs have to be mastered.
Now, other important conclusion which we have made from the attempting strategy of papers from me, from Dr. Rishabh, from all of us who have cracked AIMS, is that we all have attempted high number of questions. So in INI-CET, upwards of 190 questions we have
Yeah,
attempted. I have this thought process of attempting all the questions.
yeah.
I attempt almost 199, 200 questions also is something which I attempt.
Yeah, but 190 plus you have to attempt. Earlier seniors used to say 185 plus, but no, I genuinely believe 190 plus is a must to attempt in INI-CET.
Now, if you don't know the answers to many questions, don't worry about it. You will know only 100 to 120 questions with surety.
With
The
surety.
rest have to be intelligent guesses, meaning in some of them you will be able to eliminate all three options, in some of them two options, in some of them only one of the options you'll be able to eliminate. But do take a educated, well guess on those questions.
Now, for what should be your target number of questions to get correct? So let's say if you're aiming a top 500 rank, if you're aiming a top 500 rank, your target should be at least getting 150 correct out of the 200 questions,
Right.
right? And what is the basis of this? So this is a rank versus score analysis of 2025 May INI-CET. And so at around 145 correct, you had a rank of 536. Now, due to rank inflation over the sessions, this has a little progressed. So, I am saying that 150 correct will give you a top 500 rank in INI-CET. And this is our target, right? So, what is the
And
time?
with this rank, may you achieve your dream branch. If not, maybe you might get a rank which will boost your morale to further your hard work for NEET PG 2026.
Yeah,
So, irrespective of whatever happens, you need to prepare well for INI-CET.
yes.
And other thing which we wanted to tell, that when we say previous year topic or previous year questions, it does not just mean INI-CET, it also means NEET, PG, and and
And FMG.
FMG
Yeah.
questions.
Now, what should be the study strategy for you guys? So, let's say if you're an intern versus if you're an post-intern. So, first, let's talk about interns. Now, if you're someone who is starting now and you have just finished your internship, use the resources that you have read in MBBS because वो भी fresh हैं. So, let's say आपने in your third and fourth year you attended an coaching either online or offline. You have read the main notes of that coaching, or you have handwritten few of the offline coaching if you attended. Those are the things that you need to read because that will take you less time to read. Or for example, for few of the short subjects, you have made your own notes. Then again, that should be the source that you should follow. Or let's say if you have done a crash course during MBBS, for example, few people attend this 10-day medicine offline classes, right? So that is again the source that you should read as your main note.
So if you have done something, you just have to revise it.
Yeah.
Don't be in the FOMO that in new editions
Or new,
something will
yeah.
be
Yeah.
added. Don't worry about it.
Yeah, so the main note has to be a base. Whatever new things you want to read, maybe read the rapid revision notes of that thing.
Hmm.
So let's say new edition of an app has come. So maybe read the rapid revision notes of that, not the entire thing.
Right.
Now, first step is to identify which subjects are important and which subjects have the maximum weightage. So these 9 subjects: Anat, Biochem, Path, Pharma, Micro, Biostats. Biostats is a part of PSM, Obs Gynae, Surgery, and Forensic. These will constitute around 130 questions in your paper.
Meaning 65% of the paper with
Yeah,
just half of the syllabus.
half of the syllabus, right? And so these 9 subjects are non-negotiable.
Hmm.
You have to read them. You have to get a grasp of these subjects. And in these 9 subjects, try to get at least more than 18 out of 20 questions. So let's say if in Obs and Gynae there are 20 questions, you should try to get more than 18 correct. That's how well you should study,
Hmm.
right? Because rest of the question minors may, rest of the subjects, even if you're able to get, let's say, 60 or 70%, then also you'll get 150 correct, right? So that is the importance of these 9 subjects, and this is very, very important. So you start with these 9 subjects, make sure they are very strong, then go to minor subjects like derma, psyche, orthopedics, physio, and then read medicine plus add medicine. So after these 9 subjects are done, read medicine and minors, and finally the least important subjects, anesthesia, ENT, opthal, and radio. Now ENT opthal recently have gotten a resurrection sort of, उनका
Hmm.
दोबारा जन्म हुआ है,
Hmm.
and now also around 7 questions are asked from ENT opthal. So this might change. Sometimes psychiatry, for example, 2 sessions before only 3 questions came from psychiatry, right? Ortho only 3 questions came. So this can change. But again, these 9 subjects remain. ये 9 subjects, 130 question is my guarantee.
Hmm.
Okay. Now in obs and gynae, especially in INI-CET, how is INI-CET different? INI-CET will give you obs and gynae case scenarios. Like a woman came to you, exact case scenario, labor में आई है, partogram you have drawn. How will you manage it? There will be case scenarios. What are the steps that you will follow? You are going to stitch an episiotomy, you're an intern. What are the steps you will follow? It will give you A, B, C, D, and you have to mark A, then B, then C, D, or A, D, C, A, C, B, D. So these sort of questions will come in obs and gynae. Similarly, surgery mein general surgery is very important. Biliary system, very important. Trauma, breast, these are very, very important. Now, I've made a separate video on most important topics for INI-CET. Again, you can check it out on my YouTube channel. I'll also put in a link in the description box.
Yes. Apart from this, what I have done for you guys is that I have made a day-wise first read schedule for NEET PG 2026 or INI-CET, whatever exam you are
Yeah.
aiming for.
Yeah. So it is targeted till 5th April,
Yes.
right? So you still have a lot of time for INI-CET. The INI-CET is on 16th May.
Hmm.
So you can use this
You
schedule.
can follow this schedule, and some of the topics which you have left over because you are seeing this video late, you can put it towards the end of this timetable according to you. Another important thing what I have done is that I have kept re-revision days and unstructured days. Re-revision days is that all the last 7-8 days whatever you have read, it is a day to revise all that or maybe re-revise all that, and then unstructured day for leftover things which you could not complete your day's target, I would say.
So we're
And every single day I am also creating a 20 questions mini test at 5 p.m. sharp, so that you can gauge from the topic you have read for that particular day, that if you are able to recollect that and you are able to apply that, which is available on my Telegram channel. Link is also given in the description.
Yeah. So this was regarding your first read. Let's start with these subjects, go to these subjects, and then finally anesthesia entry of the or opthal radio. Now, step 2 is to self-assess that which subjects to read first, right? So first self-assess that what is your weak subject, and try to cover your weak subject towards the beginning of this revision or reading cycle.
Now, a weak subject, you might feel that a weak subject is something which in which maybe out of 20 questions you are able to do 5 or 6 correct. Yeah, that is definitely a weak subject. But if you are now, some of might you will be feeling that what we are saying. But if you are scoring even up till 16 or 17 questions correct,
Out
consider
of 20.
out of 20, it is still a moderately weak topic,
Yeah.
moderately weak subject. You have to make more than 18 out of 20 correct to say it strong, because
Yeah.
these are how our cutoffs are these days.
Yeah, so 160 or 150, more than 150 is top 500 rank, right? So, and you, let's assume you have attempted 190 questions. So, only 40 questions you can get wrong.
Right.
And there are 19 subjects. So, per subject, only 2 questions only you can get wrong,
Right.
right? And that's why we are saying that for a major subject like obs, gynae, surgery, uh, only 2 or 3 questions you have that leverage. And if 3 questions you're getting wrong, then in some subjects you have to cover up with getting only 1 question wrong. Right? So that's why that is a weak subject. So let's say out of 20, you're getting 14, 15 questions correct, and you think that it's a strong subject. Sorry, but no, it's not a strong subject.
It's not something that we are very interested to say, but this is the truth,
Yeah,
and
this is the truth.
we need to put that out to you.
Yeah.
Now, how is the timeline which is to be there? So initially you will go through the weak subjects, and then towards the end you will go towards the strong subjects. So from 25th Jan or 1st Feb, whenever you are seeing this video, till 30th of March, please do your weak subjects, then start your strong subjects. Till 30th of April, you have entire 1 month.
Yeah.
Along with the revision of the weak subjects.
Yeah. So let's say you have finished your weak subject. My weak subject, for example, is anat, biochem, and obs and gynae. So these three subjects I've tried to cover till Feb end. Then I've covered the remaining 9 out of 9 subject, whatever remaining, I've covered it in 1 month. But then I start revising these subjects. And when I'm revising, then I cover the remaining subjects which are left. And our deadline was till 30th April. So by 30th April, at least 80% of syllabus 80% of syllabus should be read, should be concised.
Right.
This is the aim till 30th April.
Yes.
Now step 3 is what to read. So in these weak subjects, you have to read main notes, or let's say if you have attended a offline or an online regular class, right? Try to read the notes of that class.
But at the same time, you have to make a revisable content. So what I say is a funnel down approach. So you have to concise them, whatever you have read, into the revision notes, or highlight that so that you can revise it later.
Yeah.
Along with this, you can supplement it with first aid and any other resources which you find that will help you revise in the future.
Yeah. So weak subjects, let's say my biochemistry was weak. I was a little skeptical to directly jump into the first aid or rapid revision notes. So what I would do, I would have a good understanding of the main notes. But while I'm reading the main notes, simultaneously RR notes are also open. So I'm writing everything extra that is not given in RR note in main notes. Sorry, everything extra from main notes into my RR notes.
Yes.
So that my second reading during this R1 and R2, I already know what I have to read.
And apart from this, in the last 15 days, all the volatile topics, all the areas which you feel that you need to revisit and you will forget, PYQs, you have to just go through them again. So if you are able to read all the 19 subjects in the matter of last 10-15 days, we give you the guarantee that you will be in the top 500 ranks, but provided you are able to revise all of these subjects.
Yeah, and for that to happen, you have to do the hard work now, because now only you have to concise, right? So in the first reading, our aim is to read and concise, and that's what I said. 80% of the syllabus should be read and concised, right? Now for a strong subject, let's say my anatomy is strong, so I can directly jump to a revision notes, or let's say a BTR if it's a short subject like ENT, ophtha, anesthesia, derma, very well nicely given there, and augment them with questions. So my anatomy is strong, I do a rapid revision of anatomy and start practicing a lot of questions. So whatever stuff was left in RR notes, I have practiced them through questions and added in my RR notes. Now, which questions to do? PYQs or QBank? So first remember, PYQs are a must to do first of all. You cannot avoid having to done PYQs. You have to do them. So how many years? 10 years of PYQs, INI-CET, NEET PG and FMG. Now FMG especially last 3 years you have to do, because now the pattern is very similar in FMG and NEET PG. Right? And in fact, few of the questions I was discussing in FMG recall, they were exact repeats of NEET PG questions. One of the question was an INI-CET question, right? So the pattern is sort of merging, everything is fluid, everything is almost same. So you have to do these 3 papers.
Now, if you don't have the time to do all these 3, at least do the 5 years previous INI-CET, that constitutes 10 papers.
Yeah.
That at least you do. Before the INI-CET, before NEET PG, you should be done with all these 3 things.
Yeah. Now for question bank, do a selected question bank of only the topics that you are frequently getting wrong. So let's say you are getting again and again questions from breast wrong. So maybe try doing Q bank of breast.
Or for the topics which you are weak in. For example, I was weak in biostats. So I did the full question bank from biostats.
Yeah.
And apart from that, all the rest questions I did PYQs.
Yeah. Now, don't use PYQs as a testing resource. So, a lot of students, whenever they're doing PYQ, they get very anxious that I'm getting a lot of PYQs wrong. No, PYQs are a source of knowledge. Use them as a resource like your main notes. These this has been asked, and these topics are by buri tarah rato. Matlab you have a very deep knowledge of these, right? But at the core, you have to do the concept building for those top 9 subjects that I've mentioned previously, right? Now, let's say you are starting pathology. Let's say you've started with pathology. You have allotted 7 days or 8 days to pathology. How will you go about it? So, in the first day, do 8 years of previous year questions of pathology. So, while doing PYQs, you'll get to know what are frequently asked topics and then write down these topics in a separate page or a notebook.
Also, you can mention what are those specific topics which you are getting more wrong. So you will have an analysis of the topics which you need to focus more on as well.
Now, you've read them from your main notes, annotated them in your RR notes, and simultaneously you are doing more questions from the topics that you are getting wrong. So, for example, I'm getting questions of acute leukemias wrong again and again. So, I'll try to go back to the main Q bank and write extra stuff that is given in the main Q bank in my RR notes. For example, as Aman mentioned, biostats say he was getting questions wrong. So he did the entire Q bank of biostats and added extra things. Now, simultaneously, when you are doing this subject, let's say you're doing pathology, make a separate notebook known as a choti copy or 20th notebook, whatever. And in this notebook, write down the most forgetful part of that topic. For example, in pathology, hemat, I was again and again forgetting CD markers, right? So maybe I took a printout or a photo, or I wrote them by my hand, all the CD markers and what are they used, right? This has to be done in a first reading. And this can't be done in later revisions because later revisions are meant for more question solving, more grand test giving, and GT analysis. This labor, this hard work has to be done in the first 3 months. Okay? And this is what students miss. They don't think that now is the time to concise. No, now is the time to read and concise. And that's why I'm saying that concising notes is the most important part of your INI-CET and NEET PG prep.
Right.
Right? Now let's come to GTs. Now till 30th March, giving 1 GT per month is good enough if you're targeting NEET PG.
And 1 GT per month keeps the FOMO away, which
Okay.
I always say. So, irrespective of whatever you have completed, just give the GT. I know that you will not be able to answer questions of the topics which you have not read, but still give it because it will get you into that phase of giving the GTs. From April onwards, give 1 GT every week. And in the last 2 months, if possible, please go to the center and attempt computer based tests rather than sitting on your home and attempting on the phone. Even if you are attempting on the home, attempt it on a computer screen with a mouse attached.
Yeah.
So as to give you a real feel of the exam.
Yeah.
And lastly, in the last 10 days, no point of giving GTs, just read the volatile topics, go through all the 19 subjects once again, all the volatile topics.
Now, lastly, we'll talk about what should be your day-wise timetable if you are preparing. So, this is the timetable that I followed in the last 3 months. And let's say you're talking to INI-CET, 3 months ही बचे हैं अभी.
So most of the people, they end up getting up at maybe 9.
8.
9. They get up in the morning at 9. And by getting up, I mean that they open their eyes, but then close it again. And then they finally sit to study at maybe around 10:30 a.m.
Yeah. So, the first study session, has to be a 3-hour study session.
This is very important.
Right.
If you get your first part of the day right, everything falls in place.
Yeah. So please avoid getting up at around 11 and 12 and then starting your day. Even if you're a night owl, please wind up your studies by around 2, right? So that you can get up at around 9 a.m., right? And so do a 3-hour study session before lunch. And this has to be a continuous 3-hour study session. Okay? There should be no Pomodoro technique. A 3-hour study session, you have to sit there because you want to build a habit of sitting for 3 hours. The main exam is for 3 hours, guys, right? Before lunch, we are doing a 3-hour revision, 3-hour study, then a lunch break.
Take a good 1 hour break, no problem. Then 1.5 hours of studies.
Yeah. So 1.5 hours, 2 blocks, 1.5 hours each, separated by a half an hour break. Right? Now then you have your evening snacks from 6 to 7, and then a 2-hour study session from 7 p.m. to 9 p.m.
then is the dinner time for 1 hour, and then what you can do is last 2 hours if you are sleeping at 12, or you can stretch it up to 10 to 12 and then taking a small break, and from 12:30 to 2:30
Yeah.
the last stretch.
Yeah. So this will make around 12 hours of study session. It's on the upper limit, sort of, that students towards the end of the preparation sort of pull up. But again, 6 to 7 hours of study sessions is easily doable, guys. And it will be very easy for you to do a 7 to 8 hour study session if you complete 3 hours before lunch, right? Because in the rest of the day you only have to study 5 hours now. Now, those of you who are doing a job, they might say that, sir, we have difficulty in managing time. So yes, you are right. If you are in a 9 to 5 jobs, the only time that you can study is from 7 to 9 p.m. and then 10 to 1 a.m., right? Because you will also have a 1 hour dinner. You'll come from work, maybe
Have to rest a
have to
bit.
rest a
That's
bit.
why we have given a 2 hour break.
Yeah.
In that portion.
So around 5 hour study session, you can still pull off if you are doing a job.
And this is the difference you see between a person who is doing a job or internship versus a person who
Only
has the
study.
entire time to study.
Yeah.
5 hours versus 12 hours.
Yeah.
And that is why you have to leave the job, try to leave the job 2 months before the exam, or take a long break, like a
Yeah.
long leave as much
If
as possible.
possible, yeah, if possible, because yeah, we do realize that it's not possible for a lot of students.
Hmm.
But if your condition allows it,
Hmm.
then please consider taking a leave for 2 months before the exam, right? Now, for post interns,
Some
the
few final suggestions for them. Rest is the same.
same.
The important differences would be that
More focus more on the weak subject, because you have already done one reading of your entire syllabus. So now mainly focus on weak subjects and concise them in RR, because your main problem was lack of revisions. That's why you could not get the desired rank that you wanted. So focus more on revisions, concising your stuff, and join a test and discussion. That will really streamline your preparation if you're preparing for INI-CET. Now, old PYQs.
because you have already done the recent PYQs. So doing these old PYQs is more important than doing random question banks and random questions.
Yeah. And lastly, I would like to say a few words about first aid, especially for those who are reattempting the exam. Because, whenever you are rereading your main notes, it feels a little monotonous. And for you, first aid again is a very good resource, because everything is very concise in a way that you can remember. If you read first aid, the mnemonics are so well. 50% of the mnemonics that are in online or social media are from first aid only, right? So first aid will really help you make a mind map of entire 19 subjects, or if not 19, at least first and second year subjects, which are most important for your INI-CET, right? So that is all from our side.
We really wish to see you in your dream branch, in your dream medical college. Especially, I would love to have you as my junior at AIMS New Delhi. Would love to welcome you and show you around. Uh, if it has been your dream to crack AIMS, this is your chance. Please start studying and give this INI-CET attempt your best study and best time you have ever studied so far in your life. We wish you all the very best.
All the very best, guys. I'll see you in the next video.